right, everyone. So we'll go ahead and get started on immunologic emergencies. This is a fairly quick chapter, but very, very high yield condition called anaphylaxis, allergic reactions, really falls into that, and that's pretty much all this chapter talks about. So we'll talk about what that is and why it's important. And so, allergy-related emergencies can involve acute airway obstruction and cardiovascular collapse. It's a form of distributive shock, and so this is very bad. I mean, it's very lethal when people have full-blown allergic reactions. Okay. So, what's commonly tested though is you have to distinguish the body's usual response to an allergen and allergic reaction. And so, we'll talk about what that means. But I was giving you an example. I'm allergic to tree nuts, okay, like pecans. And so, if I already eat a pecan and have anaphylaxis, the pecan itself is not causing my airway to swell shut and all that, right? It's actually my body's response to the pecan that's causing that. And so it's this exaggerated immune response that creates anaphylaxis, and that's why that happens, and it's commonly tested. They'll ask that, like, what's the response to this? It's the body's over exaggerated response to the antigen, not the antigen itself. So same thing with like a bee sting. It's not the bee sting itself that's killing them with anaphylaxis. It's the response to the bee sting. And so the immune system protects the human body from foreign substances and organisms, okay? And so in my case, my body thinks that pecans are like so foreign that they should hit the big red panic button and nuke the body to try to save it. But it actually ends up killing itself, right, without intervention. So be aware of that, okay? And so, but that's just one example, right? That's the most extreme example of anaphylaxis. But, a better example could be salmonella, Staph aureus, organisms like protozoans, like trichinella, and giardia, and all these other organisms that can enter your body, that could cause problems for humans. So, you have cellular and humoral immunity. I don't think it's important for an EMT to distinguish the difference between the two. But just be aware there's multiple different ways that our body will fight, and I'll give you the high yield ones that you need to know. And so general categories of allergens could be insect bites and stings, okay? Bees, wasps, scorpions, doesn't matter, okay? Medications, okay? So a lot of people are allergic to penicillins, okay? Plants, I'm also allergic to poison ivy. I don't get anaphylaxis, but I get a local reaction. It's a little different. But you could be allergic to derivatives of plants, that are used in medications or foods or cosmetics. Foods, obviously. People are allergic to peanut butter and pecans and all sorts of stuff. And chemicals, right? Some people are allergic to certain chemicals, okay? Like using cosmetics or using cleaners or whatever it is, okay? Now, allergens themselves are usually like pollen, right? It's pretty harmless usually, right? And so it's not pollen that's killing you, it's your response to pollen. And so, what happens is your body will produce these things called antibodies to an antigen. So in this case, let's just call pollen the antigen, okay? But your body will produce antibodies, okay? And these are these little like Y-looking things that will bind. So in this case, we'll act like this is, a bacteria. We'll just act like it's a bacteria or pollen or whatever. But you can see that you have, after the second exposure, right? Okay, let me take 2 steps back. I get too excited about this. The very first time you're exposed to a bacteria, or for me, tree nuts, I did not have an allergic response. Okay, that's a test question. I swear to you, that will show up. If you can't have an allergic reaction to the very first time you were exposed to something. The very first time I was exposed to tree nuts, something called sensitization took place, where my body grew a sensitivity to that antigen. My body thought, oh, tree nuts are bad, pecans are bad, so we need to create antibodies against that. Okay, so that's what happened. And so these antibodies are these little Y-shaped things that float around in your blood that will, when they find, there's Y-shaped things floating around in my blood right now called antibodies that are just waiting for a little pecan antigen to be floating around. And as soon as they make contact with it, they're going to bind to it. Because the antigen, the pecan, and the antibody have to be a perfect match. And when they do match, they send off signals, okay? So realize antibodies vary. So you have different antibodies for COVID versus pollen versus the flu vaccine or whatever. You have antibodies for all of that, okay? And so you have lots of antibodies in your body. And so what happens is these antibodies, one way they can work, I want to explain how they work, is they can, and you don't need to memorize this. I just think it's helpful for you to realize like what antibodies, how they work. They can, one way is through neutralization, where they'll literally just bind up and like engulf and like kind of deactivate all the receptors on the antigen. Okay, so the antibody prevents bacterial adherence. So it's like in this case, it's a bacteria. If it's been bound up, it can't even like adhere or stick to the mucosa or whatever. Okay, so that's one way this happens. Another way this happens is the antibodies will flag it, and it's called opsonization, which means to prepare to eat. And so it'll flag it for phagocytosis by these Pac-Man guys. And so that's one way. It flags it, like puts these flashing red lights on it saying, eat this one next. And so that will happen. And then the third way this will happen is in a common way is called complement activation. And this is where it flags it. And this is like where it sends all the cavalry and they start dropping these bombs called granzymes. And they'll start a membrane attack complex too called MAC. And it'll like drill holes into this pollen or in this case a bacteria. And it'll do all these. And then it'll also at the end engulf it. So this MAC thing, this happens in gonorrhea, for example, is like a common example we use in medical school. But you just be aware that these all exist. So that's what antibodies do. Okay, so like for example, when you go and get a flu shot, you're producing, so you're sensitized to it after that. So then your body recognizes like, oh, flu shot, that was that bad thing a few months ago. So that way, when you're exposed to the flu, you already have these little Y-shaped antibodies floating around in your blood that'll go, boom, we know this guy, he's bad. Let's get rid of him. Let's take him out. And so that way it protects you. So that's how that happens. Okay. Now, foreign substances can invade through the skin, respiratory tract, or GI issues. That's not surprising, right? That makes sense. But it can be through injection, absorption, inhalation, or ingestion. Ingestion is to eat. Now, the body develops sensitivity through the primary response, okay? And so remember, the very first time you were exposed to a wasp bite or a bee bite or a bee sting, or a tree nut or a peanut or whatever, you do not have an anaphylactic reaction. It's not possible. And it's tested. I swear to you, it's tested. So be aware of that. Now, body places specific antibodies on the basophils and the mast cells, and these guys carry these things called, well, I'll just tell you, called histamine. And so histamine is this very potent vasodilator. And so I'll actually draw this out for you. So let's say you get slapped on the cheek, okay? And you notice it gets really red pretty quick. Well, what happens is that causes an inflammatory response that tells these cells, release a little histamine, because we want all the white blood cells and red blood cells and everything to leak through the vasculature, and let's increase the amount here. So instead of the vessel being narrow like this, it goes like this, whoop, and it opens up. And as it opens up, it slows down. And so they start rolling, and then it'll diapedesis, it'll seep through. So that's what histamine does. It's a very potent, it's a smooth muscle relaxant, but it causes, or smooth muscle constrictor, but it causes leaky of the capillaries, and it causes it causes margination of the vessels. And so that's an important thing to know. Okay. Now here's how this happens. Let me just draw this out for you. You, student, are stung by a bee. Ouch. Okay. And so your body, you've been stung by bees before, and you know that you have a really bad anaphylactic reaction to bee stings. Okay. And in fact, there's this thing called sensitization, where with each bee attack, each bee sting, your response will get worse and worse and worse. So your second bee sting will not be as bad as your 10th bee sting, right? 10 years later, because your body has produced more antibodies with each time it's exposed to this. Okay. So boom, you're stung by a bee. Ouch. It releases its antigen. In this case, it's through its stinger, through injection, through your skin. It's an injection. Okay. Your body's like, oh, I know this guy. We have the perfect Y-shaped thing sitting on this mast cell or basophil that recognizes this bee sting poison. We need to hit the big red panic, go nuclear North Korea button. And so boom, they slap the button, and it tells that cell, give it all you got, dump it all. This is really bad. It's like, like the Steve Carell skit of like, nobody panic, right? But everybody's panicking. And so like it dumps everything. It dumps all the basophil and histamine, right? It dumps all the histamine from the basophil and mast cells. And so this becomes quite a problem. So boom, all these bombs are talking about is histamine. and then so this histamine has an effect on systemically, okay? Because this happens at such a like this becomes such an exaggerated response. It's not just one mast cell or basophil that is uh, releasing its histamine; it's all of them, and so this becomes a system-wide issue. And so in the lungs, how this presents is with something called bronchospasm. And how will this present? Wheezing, wheezing, yes, wheezing, okay, and vasoconstriction in the lungs, okay. Mainly, I need you to know this one. You got to know it's bronchospasm, which means wheezing. Those are synonymous. Bronchospasm equals wheezing. The next thing that'll happen is the heart will decrease output, but and you well, this is like late stage, and you would decrease coronary flow. So remember, the coronaries are these little vessels right here that feed the heart myocardium, the muscle of the heart itself, with oxygenated blood. And then the blood vessels will vasodilate and they become leaky. Okay, what happens is I'll just draw this out for you. Your blood actually has little slits in it, your blood vessels, and there's these little myocytes that sit on there. I think they're actually called pericytes. And so what happens is histamine causes, I told you it's a smooth muscle constrictor. Well, that's why you're getting constriction in the smooth muscle in the lungs. Well, what happens is it squeezes this together. And so this comes squeezed together. So now you have a bigger gap here. And so now blood can leak out, and plasma and white blood cells can leak out. So that's why this happens, okay? And so this is where you get edema in the lungs, bronchoconstriction, smooth muscle constriction, okay? And you get leakiness of the vessels. This leakiness turns into a form of shock. Student, please, we're on chapter 22. Please tell me what type of shock is associated with anaphylaxis. It's distributive shock. Remember, the vasculature has become leaky, so it is leaking it into the third space. Okay, it's third spacing. So you have distributive shock. You have the same amount of blood in your body. It's just distributed to the wrong place. It's out of the vessels. So it's distributive shock. And on the skin, you'll get what's called pruritus. This is the medical word for itchiness. Urticaria, that's the medical word for hives. And edema, that's the medical word for swelling. Very important you know those words. They'll show up in vignettes. Pruritus means to itch. Urticaria means hives. Edema means swelling. Okay? So this is anaphylaxis. And so I've had anaphylaxis before, and this is what it looks like. Okay? Love Little Panda, but one time they must have put nuts in my chicken fried rice. And I actually looked like this for like 4 days. Or it was 4 days. It was like 7 to 8 days. It's awful. Thankfully, my airway didn't swell. This is probably like 6 years ago. And so this is these are hives, okay? And so this is what it looks like. And so, this is whole body, so you would think this is most likely something that's been ingested, like penicillin or a nut or something like that. And so hives, I think the original term of that is means to reach for the heavens, because they're usually raised, they itch, and they're swollen, they're edema. And so be aware, and these tend to present in areas of warmth, so you'll see these under the armpit and the folds of the neck first, okay? Very bad when this happens. If you see this, you need to be like, oh my gosh, is their airway swelling shut? Do I need to give epinephrine? Okay? Now, I do want to make a distinction for the real world. My rash looked this bad, but I did not have airway swelling, okay? So you can have a rash that is severe and not have airway swelling, okay? So this patient, if they don't have airway swelling, they don't need epinephrine. If they do have airway swelling, they definitely need epinephrine. Now, the pathophysiology, I've explained this, but I'll read it to you. The immune system becomes hypersensitive. It's an over-exaggerated response. It's too sensitive to the pecan or the bee sting to one or more substances during during the abnormal reaction. So the allergic reaction, the immune system reaction that occurs when a person has been previously exposed or sensitized to a substance or allergen. So an allergic reaction is mild or localized or systemic. This would be pollen for most people, runny noses, itchy eyes, blah, 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 okay? Hypersensitivity is exaggerated or inappropriate allergic symptoms. It's a little different than a true allergic reaction. I won't get into that, but just know it's fairly synonymous to an allergic reaction. And anaphylaxis is the most extreme, and this is mediated by IgE antibodies that are found on basophil and mast cells. Just be aware. And then we have this thing called an anaphylactoid reaction. So the word toid in medicine means it, and I quote, it looks like, but it ain't. So anaphylactoid means it looks like an anaphylaxis reaction, but it ain't. Okay, and so it's not truly going through the Ig antibody mechanism that would be required for anaphylaxis, but it's still severe. So as an EMT, it's really, and clinically, it's not important for you to differentiate that. We treat patients that have airway swelling. We give them epinephrine and shortness of breath. We give them oxygen and Benadryl and stuff like that. We'll talk about that now. Mast cells recognize the invading substance and release the chemical mediators. Histamine is the main one. Leukotrienes, there's a few others, but histamine is a really important one. The white blood cells will help engulf and destroy the foreign substances, and the platelets can begin to clump together. Now, this is an example of this is a better example of hives, more likely what you'll see in the acute phase. You can see how like they're red and they're like raised, right? And so the other word for this could be there's annoying. There's three different words for this: wills, hives, and urticaria. They're all synonymous for you. They're all synonymous. They're all the same thing. So wills equals hives equals urticaria. They're the same thing. So students get confused because there's three different words that we use for these. And so the initial effect may be seen from the release of histamines. Later release of leukotrienes compounds the effect of the histamine. So it's like a snowball effect. So if someone has true anaphylaxis, from the time they're stung by a bee to the time they're probably like full-blown cardiac arrest dead, 30, 45 minutes, maybe an hour, probably less than that, less than an hour. So this is one of the true life-threatening medical emergencies that we encounter. If you get this, I mean, this is kick the tire, light the fires. Like, this is a true medical emergency. And as a paramedic, it's a lot of fun because you throw a lot of pharmacology at these patients, and you have to do a lot of things really quick. As an EMT too, I'd say, yeah, this is probably the most you'll do. There's a lot to be done in these calls. And so skin symptoms, these are often where you'll see first, they'll see hives. Now, with that, patients don't always notice that. They'll just think like, oh, I just thought it was a little itchy. It's like, sir, you're covered in hives. So anyways, angioedema. What does angioedema mean? You must know this word. It is swelling of the tongue. Think about this. What will happen if someone's tongue swells 4 times its normal size? You'll swell off their airway. Okay, their mouth swells 4 times its normal size. It'll swell, or their lips, or whatever. You'll swell off their airway to where they can't get air back. And it doesn't matter how good you are with a BVM, or you can't put in OPA or NPA to get past that swollen tongue. They're going to die. So as a paramedic, we put a cut right here in their throat and do a surgical airway called a cricothyrotomy. Now, respiratory symptoms are a very common complaint. They'll complain of dyspnea, anxiety. They'll be anxious, short of breath. You'll hear wheezing. Okay, let me back up. You'll hear wheezing when you listen to the lungs, but you'll hear stridor up here if they have airway swelling. What's stridor? Remember, stridor is inspiratory, high-pitched sounds. It sounds like wheezing of the throat, but it's on inspiration. Remember, wheezing is an obstructive pathology. It's a hard time getting air out. So it's when they breathe out, you hear wheezing. When they breathe in, you hear stridor. I'll mimic a stridor right now just for you. That's how much I care about your education. They sound like this. That's stridor. You can fake stridor, okay? And so stridor is this high-pitched inspiratory noise, and it's airway swelling, okay? Very bad, okay, when this happens in anaphylaxis. Now, the cardiovascular symptoms are you're going to get cardiac collapse from the distributive shock because you'll have a decreased preload. You'll end up with all your blood's in the third space, so it's not making its way back to the heart, the right side of the heart, and so you end up with cardiac collapse. So this is why they die. It's because they'll become what would you see with this, right? With the cardiovascular collapse, you're going to see hypotension, late finding, and tachycardia, okay? Respiratory, tachycardia, wheezing, stridor in the upper airway, okay? These are things that you're going to see on the vital signs. SpO2, it's going to be low, okay? Because they're dying. They're in shock. Whoops. Now, the blood volume moving from the intravascular space to the extravascular space can cause shock. What type of shock? Distributive shock. It's distributed, right? It's in the third spacing. It's in the extravascular space. GI symptoms can occur. I wouldn't hang my hat on that. Patients that are dying tend not to care if they're nauseated or have to poop, but they could complain of that. Central nervous systems, you would get a headache, dizziness, confusion, anxiety. I've seen this before. They're extremely anxious. And in a sense of impending doom, I've told you before in my lectures, if a patient tells you they're going to die, you should believe them. That's very serious. I've had this happen where patients are like, I'm going to die, and they did die. The ones that it's actually surprising. Like if they tell you they're going to die or they feel like, oh, I feel like this is not going to end well, believe them. They know. Now, um, the on to patient assessment. So problem identification and intervention, this is one where you got to be really quick. You do not have time to mess around. Within seconds is crucial. Oh, hives, shortness of breath, low blood pressure, boom, anaphylaxis, epinephrine now, right? So it's like that, like boom, move quickly. So the response to antigens may occur in a multi-step manner, right? Reactions can be acute or they can be delayed. Now, the one I keep describing is anaphylaxis. It's the most acute one. It's the most rapid one. It's the most deadly one. But they can be prolonged and last for days, okay? So if you ate, in my case, chicken fried rice, and that antigen was pecan or whatever snuck in there, was floating around in my intestines and in my blood for like 10 days, then I had hives for 10 days, okay? So it can last for a while, okay? Now, and there's this thing called the biphasic response. The patient experiences an initial reaction, they appear to be okay, and then they experience a recurrence of symptoms. So this is why it's important these patients go to the hospital for observation. So what you'll see is they'll be like, oh, I was stung by a bee, I already took the Benadryl, and I already gave myself my EpiPen, I'm fine, I don't want to go. You leave, they're adamant, you explain the risk of refusal, whatever. They refuse the AMA, you leave, and then like 30 minutes later, they don't have more epinephrine or whatever, and then boom, they're dead in the shower, right? Because they had a reoccurrence. So you can have a rebound phenomenon of this. That's called a biphasic response. This is common. Where else does this happen? In overdoses, where you Narcan someone, you give them the antidote, and then they're, oh no, I'm fine, I'm fine, and then like an hour later, they're dead in the street because the Narcan wore off. So this is the patients that you encourage very highly to go to the hospital for observation. Now, scene size up. Obviously, if there's an active bee attack, you don't go charging in, okay? So be aware of that in vignettes. They'll trick you. The patient swarmed by bees. What do? You retreat to safety. The patient's swarming in bees, and he's running to you for help. What do? You retreat to safety. Okay, so watch for that. Your safety is first. Never in a scene where there's, this is important. Never enter a scene where more than one person is experiencing the same set of symptoms at a similar onset. So I'll give you an example. You go to like a nursing home and everyone in the dining room is now dizzy and short of breath and cherry red. What does it sound like? Carbon monoxide poisoning. Don't go in there, right? They'll trick you into that, okay? If you have multiple patients with the same complaint, use stage, fire and PD, where usually fire needs to make sure the scene's safe because you have to worry about like carbon monoxide or poisoning or something like that, okay? Now, severity of the problem will be indicated by the patient's presentation. Respiratory symptoms should be swiftly addressed, okay, and assessed. Position and alert patient in the tripod position, leaning forward. Remember, this is when their hands on their knees leaning forward. It opens up the lungs and allows the diaphragm to fully expand. For unresponsive patients, you're going to go straight to using assisting the ventilations with a bag mask device, a BVM. So you're going to give basic life support, right? And the treatments include you're going to administer oxygen, place the patient in a supine position, prevent the loss of body heat. These are our standard shock treatments. Continue your assessment, all right? Try to keep the patient calm. Get a good history. Has this ever happened before? Do you have a family history? Allergens kind of run in families, okay? So that's a possibility. So you could ask, like, does anybody else in the history have allergies or, whatever? Identify the signs and symptoms. Do your sample. Include your OPQRST, right? This is onset, provocation, quality, radiation, severity, and time. It's how we assess and document pain. And so perform a physical exam, right? Vital signs help determine whether the body is compensating for the stress of this. And you're going to use your monitoring device. This is where you're going to want to, like, if you have capnography and you're allowed to use it. Certainly put them on the SpO2, the pulse oximetry, right? Assess their blood pressure every 5 minutes. No more than that, but every 5 minutes. So you're going to do your physical exam on the way to the hospital, right? Look for their airway compromise. So ways you could ask this: do you have any hard time swallowing? Asking them to speak if their mouth feels full or their speech sounds like it's full, like their mouth is full, they're talking with a full mouth. You need to be worried that their airway is going to swell shut. Okay. So we're going to give the epinephrine if we can, right? And you're going to see if the patient's approved. And sometimes you have to do a second dose. So if you don't know, epinephrine's prescribed in 2-packs. Because it's not uncommon, you'll give a dose and wait like 4 or 5 minutes and have to give another dose. That's actually pretty common. So be aware of that. It's not like the movies you give one epinephrine and they're like, oh, better, right? It's not like that. Sometimes you have to give multiple. I don't have a lot to add on this. So, contact medical control is going to depend on your findings. In some allergic reactions, you might be able to use standing orders to administer epinephrine. In the National Registry, a lot of times, as an EMT basic, you have to use the patient's prescribed EpiPen. I'll show you how to do that. We'll go over that in class. It's a specific skill. And ensure to record patient's response to the treatment. Okay. So, um, there's two groups, right, that we can separate these patients into. And I've been talking a lot about the second group, the anaphylaxis, but let's talk about the first group. Patients that have a little rash, a little meh, right, but they don't have full-blown anaphylaxis, that's one group, right? But the second group, the one that we're really worried about and I'm focusing on, is the ones that have anaphylaxis, right? The most extreme allergic reaction, the IgE cellular mediated or antibody mediated reaction. And so they'll require 100% oxygen, epinephrine, and antihistamine. What's antihistamine? Studente, this is Benadryl. Okay? Diphenhydramine is the trade name, or is the generic name. I'm sorry, Benadryl is the trade name. And so early administration of epinephrine should always be your priority. Now, with that, not every patient stung by a bee, not every patient that smells peanut butter needs an EpiPen, but I would recommend you err on the side of give the EpiPen than not, okay? Especially as an EMT. And so the IM route, use the IM route if the patient shows evidence of airway or respiratory compromise or hypotension. So if their blood pressure 70 over 30, right? But they're like, oh, my airway's fine. You still give it, okay? But typically that would be rare that it's isolated. Usually they'll be like, I'm short of breath, my air was swelling, and they have hypotension with tachycardia to try to compensate. So you administer it in the lateral thigh, all right? So the outer thigh, mid thigh. You can go straight through the clothing if necessary. These have spring-loaded needles in them. We'll pop one off in class and we'll shove it into a clear water bottle so you can see what it looks like. They're pretty cool. But yeah, these are all out there. This is like there are different brands. This is the AviQ and this is the generic one. So just be aware. Epinephrine can rapidly reverse the histamine-related effects of anaphylaxis. So epinephrine doesn't block histamine; it blocks the effects of histamine. To truly block histamine, that's Benadryl. That's diphenhydramine. Okay. So Benadryl is cardiotoxic. Let me start with that. Doesn't mean we don't give it, but it is toxic to the heart. And so you'll get tachycardia, high heart rate, right? Hypertension, anxiety, pallor, so like pale skin, dizziness, chest pain, headache, nausea, and vomiting with when you give this. The name for adrenaline or of epinephrine is adrenaline. So it's like this huge adrenaline dump. And so you would get all this with adrenaline, right? And so it's kind of intuitive that those things would happen. But be aware, you give someone epinephrine IM, their heart rate will probably jump from like 100 to 130. That's 140. That's probably going to happen. Now, so that's it on anaphylaxis. Okay, we'll cover this in class with how to give this specifically, and we'll run some scenarios so we become like bada bing, bada boom. One thing I'll add on this is you can give in anaphylaxis, you can give beta 2 agonist like albuterol. You can give albuterol nebulized. So when you put the oxygen mask on them at 100%, you can nebulize albuterol as well because that'll reduce the bronchoconstriction and bronchodilate the bronchioles in the lungs. So that's a standard of care too. So the standard of care is really epinephrine, beta 2 agonists like albuterol, Benadryl, and oxygen rapid transport. So insect bites and stings, approximately 90 to 100 deaths each year in the United States. The stinging organs of most bees, wasps, and hornets is a small, hollow spine-like projection from the abdomen. Um, you know, Obviously ants can there's people that are highly allergic to ants, right? Some ants, especially fire ants, will strike repeatedly, injecting a particular irritating toxin or poison at the bite site. If you live in Texas, you've experienced this. Yeah, fire ants. Don't know why God put those on Earth. Okay, and signs and symptoms include this from we've experienced this luckily. So what I'm saying is like if you get lost in exams, like, well, I've been bit by a fire ant. What did that feel like, right? Sudden pain, swelling, localized heat. You could have widespread urticaria. Remember that's the medical word for hives. Redness and light skinned people, right? Light skin like white people. It can be itching and you can form a wheal. This is a wheal. Okay. Now, what do you do? Someone's been stung by a bee. What do you do? Sometimes ice can reduce that localized response and make the swelling and irritation less severe. But what you're going to do is you're going to remove the stinger. And I don't even have anything with me. I guess we'll use this. But okay, so if this is the skin, the stinger tends to go at an angle like this. And then there's like a little poison sac. And so what you do is you want to scrape the skin with the edge. So you want to scrape it out. So like I'm scraping my skin or my screen. You'd want to like scrape it with like a credit card or something like that, or a driver's license to try to scrape it out. What you don't want to do is take tweezers or something like that and pull it out. Or squeeze it out with your fingertips or something, because there's a poison sac at the end of this that's pulsating. So if you grab it, you're going to dump all the poison into the patient. So you don't want to do that. So the preferred method, not the redneck Hunter Hobble method, I'm telling you, it's actually to use like a credit card and to scrape it away. All right. So be alert for with insect bites can lead to anaphylaxis, of course. Okay. More commonly, it's going to be a localized reaction. Pain, like I described earlier, pain, redness, wills. Now, so look for signs of anaphylaxis. Place the patient in the supine position if indicated, and give oxygen if needed. Monitor the patient. Be aware they can be fine 1 minute and then not the next. So these require frequent reobservation. Okay. I make it rain ice packs. I love giving ice packs to people. They love them. They love it. Great customer service. So give them ice packs. Educate the patient about prevention and self-preservation, right? So, I mean, not that they don't know this, but avoid the antigen, avoid pecans, okay. Notify all health personnel of the allergy. So this is typically where they'll be bound with like a bracelet in the hospital. Wear identification tags or bracelets. Carry an anaphylaxis kit or an EpiPen. You should. I mean, I do. The problem with EpiPens is they're fairly expensive, and they expire within a year. Epinephrine's pretty unstable, so it only lasts about a year. So that's the problem with them. Now, report symptoms early, right? So as soon as you're like, oh God, last time I got intubated and almost died from this bee sting, encourage the patient, call 911 as soon as that happens, and don't wait until you're dead or dying to call for help. Okay? So that's it for this chapter. It's pretty quick, but that's the gist of anaphylaxis. We're going to run some scenarios on this in class because, like I said, I want y'all to be real fine-tuned on how to run these, because these are the calls in the ambulance where things go flying. Like, you got to work quick, okay? Not chaotic, but you got to work quick. So that's it for this lecture. Thanks.